At the University of the Western Cape, we are committed to take root, a university that reaches far beyond campus boundaries. By partnering with communities and establishing offices in Bellville, Mitchells Plain, Visantekraal and Lankidoc, UWC is anchoring itself across 4 different health districts in the Western Cape province of South Africa. As mentioned, one of these communities is Mitchells Plain, a township born out of the painful history of apartheid. This community was developed as part of the Group Areas Act, which forcefully displaced people of colour from places like District 6 to the sandy stretches of the Cape Flats. Today, many people in Mitchells Plain face a health system that's complex and often stretched thin. On the public side, there's a community health centre, a district hospital and a psychiatric precinct that includes both mental health and neuro rehabilitation services. Privately, there's Mallomed Hospital, but access often depends on having medical aid, paying cash or qualifying through injury on duty claims. For many, those options simply aren't affordable. That's where UWC's Faculty of Dentistry steps in. Through a unique partnership with Mallomed, dental students provide oral health services right inside the hospital, creating a way to bring much needed care closer to the community. UWC has maintained a long-standing presence in the Lentegeur precinct through its dedicated community office. This office serves as a vital link between the university and the broader Mitchells Plain community. A fieldwork coordinator based here acts as a liaison, building and maintaining relationships with local organizations and ensuring that students are meaningfully placed within the community for their training. A few of these placement sites include Mustadafin Foundation, Baitul Ansar, and Beaconvale Frail Care and Autism Connect. The Lentegeur office remains a central hub where students can gather, debrief and reach out for support during their placements, creating a space that is both practical and supportive as they learn through serving the community.
In 2023, this office took a bold step forward. Not just a liaison point for student placements anymore, it became the UWC Interprofessional Student-Led Wellness Centre. This centre represents an innovative response to deep-rooted health disparities, offering a model of care that reframes access for vulnerable, marginalized and complex population. It tackles the very issues that compromise patient outcomes: long waiting timeframes, fragmented care, and the bureaucratic red tape that keeps patients in limbo. At its core, the Wellness Centre offers accessible, team-based care through an interprofessional collaboration that includes physiotherapy, occupational therapy, social work, natural medicine, and dietetics, with plans to bring even more disciplines.
To ensure that the care we offer is holistic, the students placed at the Wellness Centre participate in weekly interprofessional supervision. We use an interprofessional comprehensive planning framework that guides collaborative assessments and shared intervention plans, giving students and patients a bouquet of services that can meet them where they are. But now we ask ourselves the question, does reframed access to healthcare also mean quality service?
Yes, definitely, because there's progress.
Yes, and with all the students that Isabella's been with, they do go the extra mile and make an effort to get her to buy into what they need from her in the OT sessions.
It's almost like they treat them like their own.
Yeah.
As the centre continues to evolve, our IPE supervisors and the fieldwork coordinator lead informal process evaluations. This includes checking in with students, partners, and patients to assess what is working and what needs to improve. We are learning, adapting, and refining, always with the patient at the center of our improvements.
Support groups.
But it would be nice if it could be while our child who's in OT to have a session as well. Maybe just like for us that's work, it would be nice to kill two birds with one stone, so to speak.
One of the center's shiny examples of interprofessional practice is the support groups initiated by social work students, often in collaboration with occupational therapy students and local organizations. These groups offer a space of community and healing for parents and caregivers of children with special needs, while their children receive therapy on site. In South Africa, long queues at public health facilities are an everyday reality for many, a reflection of a system that is under immense pressure. Patients often wake up before dawn, waiting for hours just to be seen, only to be given an appointment weeks, sometimes months down the line. This challenge isn't unique to Mitchell's Plain, but as one of the communities where UWC has chosen to strategically anchor itself, the need for more immediate accessible care was clear. Through our presence in the area, we recognize not only the urgency of the community's health needs, but also the opportunity to respond by offering a model of care that is both responsive and rooted in partnership. In many public health facilities, patients often see more than one healthcare professional: a physiotherapist, an occupational therapist, a dietitian, or a social worker. But with the overburdened systems and limited appointment slots, these visits rarely happen on the same day. This means that patients are forced to take off multiple days off work and travel to the facility several times a week, often at a great personal and financial cost. To reduce these delays, a simple Google form was created and shared with local health professionals at the Community Healthcare Centre and the District Hospital in Mitchell's Plain. Once they click submit, a referral is made and an appointment is booked, typically within 2 to 3 days, which is a significant improvement compared to the usual 4 to 6 week wait. In a context where accessing comprehensive care could mean missing an entire week's wages, this student-led initiative offers more than just services. It offers dignity, relief, and real hope for a better, more accessible way forward. Striving toward the quintuple aim of health, the Wellness Centre uses the power of interprofessional education and collaborative practice to, number 1, improve the patient experience by reducing waiting times and the times between appointments. Number 2, enhance population health through the provision of promotive and preventive healthcare and interventions. Number 3, reduce the cost for both patients through interprofessional interventions offered on one day, and reduce costs for government by reducing duplication of services of health professionals. Number 3, it supports qualified health professional well-being by alleviating the pressure of the public health facilities, albeit minimal. And number 5, advance health equity by offering timely, quality care to those who need it most. By breaking traditional barriers and building a culture of collaboration, compassion, and community, this Wellness Centre reminds us that healthcare, when reimagined, can truly become healthcare for all.